with us, and then we'll have a short time for question and answer following that. So without no further ado, it is my honor to introduce Montana's Senior Senator, Jon Tester. Senator Tester, thank you for joining us, and the floor is yours.
Thanks, Nick, and a huge thank you to Protect Our Care for holding this event and drawing attention to really the most important issue in this country, and that's healthcare. I'll get right to the point. I believe the efforts by this administration to repeal the ACA is reckless, and it would put millions of Americans and thousands of Montanans at risk at a time when they can least afford it. Ripping away healthcare coverage during a public health crisis, including for 133 million Americans with pre-existing conditions, is irresponsible at best. But the fact is, it's downright cruel. It jeopardizes lives. It jeopardizes our economy. Scrapping the Affordable Care Act would also be a death knell for rural Montana hospitals that rely on it to keep their doors open and to serve the communities that would otherwise have to drive hundreds of miles for healthcare. And while the ACA is not perfect, scrapping it with no replacement would mean putting millions out in the cold in the middle of a global health emergency. My Republican colleagues claim not to want to do that. You've probably seen ads on TV right now where they say they'll work to make sure people with pre-existing conditions are protected. The fact of the matter is that's a lie. They support the Justice Department's lawsuit to strip away coverage for folks with pre-existing conditions. And I will tell you that I've been waiting 10 years for a plan, and I've yet to see a plan come forth that covers folks with pre-existing conditions besides the ACA. Now, if that lawsuit is successful and the ACA is overturned, let me give you some numbers. 112,000 Montanans could lose their coverage, including 85,000 Montanans would lose coverage through Medicaid expansion, 7,000 Montanans under the age of 26 who have been able to stay on their parents' health care coverage. And that to boot, Montana being a aging state, we have 425,000 Montanans who have a pre-existing condition that could once again face annual or lifetime caps, medical underwriting for their insurance coverage, or flat denials for the care that they need. And that doesn't even count the more than 20,000 Montanans who now have a COVID diagnosis, which could be viewed as a pre-existing condition down the line. Montana would lose billions of dollars in federal funds, causing significant job losses and jeopardizing the viability, once again, of Montana's rural and frontier hospitals. Now, the numbers I've just laid out are staggering, but more staggering is when we remind each other that each one of those numbers is a person out of work because of the pandemic, a person with a kid with a complex medical condition, a college student, a pregnant woman, a family just like mine facing cancer diagnosis, you name it. The Affordable Care Act protects these people. That's why I'll keep fighting alongside all of you every day to make sure access to quality, affordable healthcare is there for folks who depend on it most. Once again, thank you for doing this, and thank you for inviting me to be here today. With that, it's back to you, Nick.
Thank you, Senator Tester, for those remarks and for the continued leadership you have for Montana, especially on issues as important as this. Next, we are going to hear from Governor Steve Bullock, one of the gentlemen who was the lead in bringing Montana's Medicaid to our state. Governor Bullock, all yours.
Thanks, Nick, and thank all of you for inviting me to talk about how important healthcare is in Montana. Certainly now more than ever, but even before COVID-19, access to affordable care was important to individual Montanans, and it was important to our overall economy. It's why we brought Democrats and Republicans together to expand healthcare for about 90,000 Montanans through Medicaid expansion. Got that down in 2015, reauthorized in 2019. Along the way, many things happened. Recognizing that access to affordable health care means that people are going to actually get it when they need it, meaning getting preventative care, not waiting till they have to go and waiting too long to the emergency room where it's most expensive for all of us. recognizing that even before COVID-19, 20% of rural hospitals were at risk of closing. We haven't lost to one in Montana. And when you look around the country, 70% of those rural hospital closings happened in states that didn't expand Medicaid. Recognizing that the vast majority of those on Medicaid expansion are working, and they're working Montanans, they're just not working or have enough either hours or salary, or not employer-sponsored care. You know, we know that 3 out of every 5 businesses in Montana have one or more of their employees on Medicaid expansion, getting their health care through that expansion. So it's important to the individual Montanans. Senator is absolutely right. It's not just about, Senator Tester's right, we shouldn't ever get numbed by the statistics. Like, these are individuals along the way, but there's so much more than that that's at stake as well. The 425,000 Montanans with pre-existing conditions, the senior drug benefit that the Affordable Care Act afforded. There's so much more at stake. And here's one where, look, even long before this, worked with Democratic and Republican governors to actually make sure that we're standing up and saying we can improve on the ACA. The answer isn't to strip away this coverage for Medicaid or pre-existing conditions and more. Look, the pandemic is still very much with us and presenting real challenges. But as we're focusing on today, building on what we have and ensuring that everyone has access to affordable and quality health care, something that ought not be a bipartisan issue. We brought Democrats and Republicans together to do that in Montana, and we need to be fighting, all of us together, to make sure that our care is protected. Back to you, Nick.
Thank you very much, Governor Bullock. Thank you very much, Governor Bullock. And now joining us from Billings is Dr. Ann Giuliano to give us a bit of a perspective from the front lines as a healthcare provider. Dr. Giuliano?
So thank you, Nick, and thank you to Protect Our Care for inviting me here. I really appreciate this. So good afternoon, everybody. I am Dr. Ann Giuliano, and I'm a physician in Billings, Montana, and I've been here for over 20 years. I have served the community as a hospital-based interventional radiologist, as a venous disease specialist, and as a wound care specialist. And I've seen firsthand how the Medicaid expansion and the ACA changed the realm of healthcare when it passed in 2015. So I've seen patients be able to get in to see a primary care physician and get their chronic illnesses treated. And more importantly, I've seen people be able to get preventative care. Breast cancer screenings and colonoscopies are huge to prevent downstream illness. Almost 32,000 people have been able to get outpatient mental health services, and continued access to mental health care services, especially in this time of sort of overwhelming anxiety for everybody, is really important. It's crucial. So I want to share a brief story about when I was doing wound care and I had a patient with a non-healing foot ulcer. He was a young guy and he was working in a big box store and didn't receive any benefits for his healthcare through his job. I asked him about getting on Medicaid, and he made too much money for traditional Medicaid. I asked him about getting an individual policy, and the premium for his policy was more than his take-home pay every month, so that didn't work. During the course of his care, I biopsied his ulcer, and it turned out to be an invasive cancer. And this is a guy in his 30s. Very luckily for him, this happened during the time of the Medicaid expansion, and he was actually able to get on the expansion Medicaid and get coverage for his cancer. So it literally saved his life. And I've seen this kind of story happen over and over for people. The lawsuit that's going on at the federal level has the potential to take away healthcare coverage for about 125,000 Montanans or more. You know, pre-existing conditions are huge, you know, and as Senator Tester said, COVID, anyone for a woman who has had any kind of reproductive issues, that's a pre-existing conditions. So I don't know how many people realize this, but the funding for the Medicaid expansion actually comes through the ACA. And if the ACA gets overturned, the Medicaid expansion goes away. And the state of Montana just can't afford to keep it going as it is without some sort of radical change. So during this pandemic, access to healthcare and preventative services has really never been more important. As was already mentioned, the ACA allows 7,000 Montanans, young Montanans, to stay on their parents' health insurance until they're 26, and over 13,000 kids get coverage through the Big Sky program. So without the program, those kids will go without healthcare. Our hospitals and our local healthcare systems need the expansion and the ACA to remain financially viable and fiscally viable. And we would lose our rural hospitals without it. So now, more than ever, we need to trust what our healthcare leaders and what the data is showing us. And what we are telling you is that Montana cannot afford to lose the ACA, and we cannot afford to lose the Medicaid expansion. So thank you very much for inviting me and allowing me to have a couple words. And with that, I'm going to pass back to Nick.
Thank you, Dr. Giuliano. It's always a pleasure to have you with us again. Next, we move on to another longstanding friend of Protect Our Care Montana, Ms. Amy Casio of Missoula. Amy?
Hi, Nick. Thanks so much for the opportunity to be here, and thank you for all the work through Protect Our Care Montana. And I'm here to just share a personal story, because when we talk a lot about numbers and statistics, it can tend to feel a little bit big and impersonal. So I just thought I'd share how the ACA saved my life. And I am a cancer survivor, and I'm also a small business owner here in Missoula, Montana. So in January 2015, I found a lump, and I brought it to the attention of my provider, who initially dismissed it as a cyst. And I had a feeling that it was something worse than that. So I advocated for myself, and I was able to access imaging because I had coverage through the Affordable Care Act. So because of imaging, we were able to get an early stage diagnosis, and I was able to successfully have surgery, chemotherapy, radiation, and now I'm in 10 years of ongoing preventative care. And so I was 38 at the time, and I can say unequivocally that the ACA is the reason that I am able, as of this week, to celebrate 5 years clear of cancer. And so something that I want to let everyone know is that the average cost of cancer is $100,000. And as a small business owner, if I did not have coverage through the ACA, I'd be facing medical bankruptcy. And so I think about all the small business owners across Montana, across the country, dealing with health challenges and what that means for Montana's economy, what that means for our US economy, with it built on the backbone of small business owners. I also want to let people know that half of Montanans, like half of us, face pre-existing conditions. So it's not something that doesn't impact, us in any real way. This is half of our state are actively facing pre-existing conditions. And in the face of this global pandemic, we're going to be seeing more of that. And so I just want to run through a list of what pre-existing conditions count as. And this is, if we do not have protection through the Affordable Care Act, we can be discriminated against by not receiving coverage and getting excluded from coverage. And we can be discriminated against by having exorbitant premiums that make it just impossible for us. So these are pre-existing conditions: pregnancy, alcohol or drug abuse with recent treatment, dementia, arthritis, cancer, cerebral palsy, epilepsy, hemophilia, hepatitis, diabetes, paralysis, severe obesity, sleep apnea, AIDS and HIV, kidney disease, multiple sclerosis, bipolar disorder, eating disorders, any pending surgery or hospitalization, and muscular dystrophy. So it's just unacceptable for our leaders and our elected officials to not be protecting our access to affordable quality healthcare. Thank you, Nick.
Thank you, Amy, and may I say congratulations on behalf of all of us. I'm really glad you decided to spend this great anniversary with us as well.
Thank you.
Next, we'll hear from Representative Sharon Stewart Paraguay. Representative?
好感謝你其他嘅俾你打開呢個社上項目，你嘅知識好I wish to thank you. That was I'm a speaker of the Crow language, and just thanking the Protect Our Care group as well as on behalf of the American Indians in Montana uh, to share our story and the impacts that the ACA has upon us. Us, the 90,000 folks that that have enrolled in Medicaid since the expansion, 17% of them are American Indians. One of the things that we need to be crystal clear about is that for the healthcare is a federal treaty obligation to the treaty tribes within the United States. For example, the Crow tribe in the 1868 treaty specifically identified health as one of the requirements in exchange for the land. Education was the other, but the 1868 is the basis of our healthcare system, as well as the other treaties during the treaty period that the United States government had entered into. There was 400 treaties to be exact. And so this is the basis of the Indian healthcare system within the United States here in Montana as well. And so 15,000 American Indians within the state of Montana currently have access to a comprehensive range of healthcare services at all locations across the state. And it's important, and this has the expansion has actually contributed to beginning to at least close the gap with the health disparities that American Indians have faced. When we talk about pre-existing conditions, some of the major impacts for American Indians in not only here in Montana but nationally, we're looking at cancer. Cancer is one of the huge disparities, as well as all the different types of heart disease, diabetes, and then also fatalities. And these are all preventable, but because of the issues that, because of the lack of access to healthcare prior to the ACA, IHS had to every year around March had to declare life or limb, and that preventative measures weren't available because even though the treaty obligation is there for Indian healthcare, it has been historically underfunded. And as a result of that, the majority of the preventative care and just basic care that the individuals needed at the local levels didn't have access to it, let alone within the outlying areas within our towns and cities within Montana. And so the Affordable Health Care Act did provide the permanent reauthorization of the Indian healthcare program. And with that, it did give permanent funding. And so that helps the American Indians at least to be able to move forward. And with the funding that came with it, and plus the expansion of Medicaid, that the American Indians were able to access, what that afforded not only the Indian Health Service to move from life to limb, to begin to move from which was level 1, to move to level 4, which is looking at preventative care. And the preventative care, meaning at the beginning, is those surgeries that people didn't have access to if they needed, if they, for example, there were instances in which we had family members that needed to have hip replacement, but because of the lack of money, they weren't able to. They had to wait it out, and part of that is that then the pain they receive pain medication, and unfortunately, over the long term, they begin to be hooked on on the pain medication, and because the hip replacement wasn't readily available to them. And so for us, it would be devastating for American Indians within Montana and across this nation for the repeal of the ACA, because we have now within the past few years have been able to take care of our people so that they can have a better quality of life. And so I I I hope and I pray that the ACA will not be repealed or overturned, and I will do anything in my capacity to make sure that that does not happen. So once again, thank you. Back to you, Nick.
Thank you, Representative. Next, we have Ms. Emily Allison from the Forward Montana Foundation to speak to us about the impact of Medicaid expansion in the ACA on Montana's young people. Ms. Allison?
Hi, everyone. I'm honored today to be here speaking on behalf of both Forward Montana Foundation and Bridger Care. Forward Montana Foundation is a nonprofit organization that works across the state to help young people register to vote and get involved in their democracy at every level, from participating in their local city commissioner meetings to running for the state legislature. And Bridger Care is the only nonprofit reproductive and sexual health care clinic in South Central Montana. We use a sliding fee scale where fees are based on income, and no one is ever turned away because they can't pay. We see over 5,000 patients a year of all genders and ages, ranging from teens to older adults. What these two organizations have in common is that we care deeply about the health, financial stability, educational opportunities, and empowerment of Montana's young people. And this is why we both care so much about the ACA and Medicaid expansion. It's been an incredible tool for lifting up so many young people and allowing them to live the lives they've always dreamed of. Because of the ACA and Medicaid expansion, birth control and preventative wellness visits are completely covered by insurance for the first time ever. And that safety net and opportunity has provided so much for so many people, and in particular, our young people, and it can't be emphasized enough. Access to birth control helps our young people avoid unplanned pregnancy, allowing them to finish high school and, for many, go to college or a trade school. We all know the value of education and how this kind of schooling benefits individuals with higher salaries and greater job opportunities in the future. Teen pregnancy rates in Montana are at a record low right now. So I don't know why we would do anything that threatens to move us backwards. The ACA and Medicaid expansion also provide freedom and mobility to some of our most vulnerable young people. Those experiencing intimate partner violence often stay with their abusive partner because they might otherwise be homeless or struggle to make ends meet on their own. And these fears are amplified when survivors have children they love dearly, who they want to keep fed and warm and safe. And the ACA and Medicaid make sure access to healthcare for survivors and their families is not a barrier that prevents them from leaving their partner when they're ready. Due to the pandemic, we're seeing patients being laid off and losing their main source of income and health insurance. And this rapid decrease in healthcare coverage and patient ability to pay makes the ACA and Medicaid expansion more important than ever before. Our staff screen patients for the ACA and Medicaid eligibility, and our certified application counselors help our patients enroll on a daily basis. We recently had a young man in his 20s who came in for a routine visit, and we were able to help him sign up for health insurance under the ACA. And a week later, he broke his arm in an accident. As a person living from paycheck to paycheck, his health insurance through the ACA kept him from racking up thousands of dollars of medical bills that would have taken him years to pay off. So instead of being crushed by debt, he was able to focus on his recovery and plan for a bright future. So if you are alive right now, which I assume all of you listening are, these programs affect you. Even if you don't use the ACA or Medicaid, you might have a family member who does, or a friend, or a coworker, or maybe your child's best friend, or even your favorite server at the local pizza restaurant. They rely on these programs for health insurance coverage. So I'd lastly just like to remind everyone that healthcare, it's both a human right and an economic stimulant, as it protects our ability to work, raise a family, and help make our communities strong and thrive. Thanks.
Thank you, Ms. Allison. That was fantastic context and some really great real-world examples of the importance of these programs in our state. Next, we have Ms. Elizabeth Marham. She's joining us from Big Sky 55 Plus.
Thank you so much for having me, and thanks for sponsoring this. Big Sky 55 advocates for and on behalf of issues that involve senior citizens across Montana. And we're also interested in future generations, because those are our families and our kids. So yes, seniors, but all of us. Montana seniors have benefited from the ACA in many ways. The ACA closed the prescription drug donut hole or coverage gap, and overall saved 10.7 million people on Medicare, $20.8 billion on prescription drugs, billion. The ACA also offers Medicare beneficiaries many preventive services with no out-of-pocket costs, like screenings for cancer, diabetes, and other chronic diseases. It allows seniors to get flu vaccines at no cost to them. Looking to the year ahead and the availability of a coronavirus vaccine, the ACA will also make it affordable for everyone, so we can protect those at highest risks, seniors. The lower Medicare Part B premiums and stronger, less expensive Medicare Advantage programs help save seniors money, and that's really important. And I'd like to just say something on behalf of pre-existing conditions. When Amy read those pre-existing conditions, I don't know of a senior anywhere that doesn't have at least one. And many of those we started with early in our 30s, 40s. And anyone that's lived has had, you know, to be blessed to be a senior has at least a little arthritis. And I do remember times before the ACA when we couldn't get coverage. I remember not going to the doctor because I didn't want to be found with one of those pre-existing conditions. Republicans know they're playing a losing game by continuing to mess with our healthcare, despite a broad majority of Americans supporting the ACA. Now Republicans are insisting that we not worry about the law being overturned. That is just plain dishonest. Worse, it's happening while Montanans are actively voting in a presidential election during a pandemic. Conservative pundits insist that severability or only striking down parts of the law are on the table. But President Trump has voiced repeatedly that he expects a level of legislating from the bench. Senate Republicans have delayed coronavirus relief and put it off, as well as pushing forward the lawsuit before the Supreme Court now. It shows us the heart of the GOP and the Trump administration, that they do not care about everyday Americans' healthcare, our well-being, and our social safety nets. They only care about furthering their political agendas and putting people in place who will fulfill their 10-year quest to destroy the Affordable Care Act. It's up to us to be that block to keep the Affordable Care Act intact for all of us, all the people that we've heard, from healthcare providers to Native American companies, to small or Native American tribes and peoples, to small businesses, to young people, to everyone. These are our communities.
Thank you very much, Ms. Barnum. And thank you all for joining us today and keeping this conversation going. Healthcare coverage under the ACA and Medicaid remains essential to our communities. And I think very honestly, it's been made obvious how interconnected both of those programs are to so many different aspects of our communities and things that keep Montana thriving. So I thank you all for your time and for sharing your thoughts and your expertise with us. My colleague Mika is now going to start the question and answer session after a few brief instructions. Mika, all yours.
Thank you, Nick, and thank you to all of our panelists today and to our audience for joining. If you would like to ask a question to one of our panelists, please state who you would like to direct the question to and use the chat box, or leave a comment if you're joining us on Facebook. Again, if you would like to ask a question, please enter it into the chat box or the comments now. Our first question is an online submission which asks, how would the Trump administration's lawsuit to eliminate the Affordable Care Act affect Montanans with pre-existing conditions? What's at stake for Montanans' healthcare?
I don't know who you want to go, but I'll shoot and then we'll let some other folks talk if you'd like. Well, it's interesting because I've had this conversation with my healthcare staffer many times about what's at stake for Montana's healthcare. And she just says one word: everything is at stake. And that's a fact. It's been pointed out today that everything from Medicaid expansion, and the doctors pointed out accurately that Medicaid expansion funding comes through the ACA, to taking care of kids that want to stay on their parents' policy under the age of 26, that would be lost, to small hospitals. And I would also say that big hospitals will be put under an incredible amount of pressure also, because the cost shifting would go back to the way it used to be pre-ACA. And the small hospitals, not unlike the one in 12 miles down the road from where I'm at right now, would be put in a severe hurt and potentially would close. And as the governor's already pointed out, so far we haven't lost any of those. I can tell you that if ACA goes away, we're not going to be able to say that. And then if you have a problem, that golden hour gets taken away, because oftentimes it'll be further than an hour to get to a hospital setting to take care of any problem you might have. So going back to what my healthcare staffer said, everything is on the line. If in fact the Supreme Court throws the ACA out and they're due to make a decision on this about a week after the election, and I know a lot of politicians have said, oh, don't worry about it, it ain't gonna happen. That's baloney, because if you listen to what people have said over the last several years, that's exactly what many of the folks want to have happen that are stand up saying, oh, no, I'm about pre-existing conditions, when in fact they have never been about pre-existing conditions. And so it puts everything on the line, especially in a rural state like Montana.
Mika, and I'll only add to that the whole premise of the lawsuit was to strike the whole thing down. So anyone that is now saying, oh, nothing to worry about, that couldn't happen, that was the basis of the lawsuit going forward. So as Senator Tester says, and as his health staffer says, everything's on the line here. And Medicaid expansion, coverage for pre-existing conditions, it's too important to play politics with. And what we've seen time and time again is folks playing politics with our healthcare and trying to take it away. You'd think we ought to be at the point where we're trying to improve and build on healthcare, not strip it away from Montanans and Americans.
Yeah, I think I should chime in on here as well. It is really not overly melodramatic to say that people will die. People will lose healthcare coverage. They will put off going to the doctor, and then when they do end up getting sick enough to go, it in a lot of these cases it'll be too late for people. So there'll be loss of life, loss of limb, and it just really boggles my mind, this concept that we could pull and potentially lose so much so many people's healthcare coverage, and there's just nothing to replace it with. And the market is about making money. The market is not about getting people better. So everything is on the line here, and I couldn't agree more. So yeah, it's not melodramatic to say that people will die. It's the truth.
And I'd like to weigh in as well. It would be devastating, particularly in terms of just all Montanans, not only the American Indians. It's about in the midst of a pandemic, and for those survivors, there are people that have been heavily impacted by COVID, and in fact, their quality of life is at stake as well. And at the end of the day, though, when we talk about um, life, liberty, and the pursuit of happiness, quality of life is important, and life is important. So, like both the governor and Senator Tester said, everything is at stake at this point. Thank you.
And I'd also love to chime in from the perspective of someone who receives a potentially life-threatening diagnosis in this moment, in the midst of a national pandemic, when they're already facing trying to keep their family safe, trying to work, or maybe they've been laid off. We look at the number of job losses. We also look at the incredibly disproportionate number of women that are out of the workforce right now, as compared to men in terms of being at home and out of the workforce, and what the ripple effects of that are going to be like. Then we also look at the stress of just going through treatment that's physical, emotional. It is just, we just keep layering more and more and more stresses on people. And at what point, there's only a point we can take so much. And then why would we get to the point where we're asking people to just buckle under all of this compounding stress? So one of the stresses we can control, because we can't control who gets diagnosed. We can't control right now who is working or not working, who is able to get a new job, get healthcare coverage. What we can control is access to the affordable healthcare through the ACA. So while there's so much chaos happening and so much disruption, let's at least take one stressful burden off the backs of Montanans and Americans and just have dependable, guaranteed access to affordable quality healthcare, and so that they don't have to worry about that when dealing with facing their own mortality and so many other stresses.
On behalf of seniors, I remember the old days. They were nearly impossible. It was bankruptcy. It was deferring on, just as Dr. Giuliano said, checkups. It was what Amy said of loss of jobs, or you have to find the right job to be able to offer that. Well, those jobs don't necessarily offer healthcare in Montana. The Affordable Care Act is vital to our economic and personal well-being. It's necessary to mental health care, physical health care, and the well-being of our families and communities. Period. End of story.
All right, I'll weigh in. Everyone else weighed in. I think about this, everyone's spoken really wonderfully to the individual level, and I'm thinking a lot about this on a systems level. So if you think about the health of our healthcare system across the state, that is super threatened as well if the ACA and Medicaid expansion were to fall. So if you think about healthcare for an individual, there is no healthcare if there is no access. And Medicaid expansion has protected rural healthcare centers and community health clinics across the state. We haven't seen a single rural hospital close since expansion, and that's not true for other states that didn't do expansion. And I can speak specifically to Bridger Care is a Title X clinic that receives both federal and state aid, but the bulk of what keeps us sustainable and our doors open is insurance reimbursement from private insurance, ACA, and Medicaid. And we've suffered a lot. We've had a $500,000 shortfall from COVID, and the federal funding has been cut dramatically for our clinic. And so that if we were to lose another thing, that is going to really affect people's access to care, and where it doesn't even matter if you have health insurance, if you have to drive 4 hours or can't get an appointment. So that's what I would weigh in, is it affects it at an individual, but also a systemic level.
Thank you all so much for your comments. Again, if you would like to ask a question, please enter it into the chat box or into the comments now. We do have another online submission, which asks, it's along the same lines, but just gets a little bit more specific. How could Montanans who contract COVID-19 and are now suffering longer term consequences be affected by the Affordable Care Act being eliminated?
Oh, I think I should chime in on this one first. So there's a significant number of people who survive COVID who end up with long-term symptoms. And those symptoms can be mild or they can be disabling. And that will be a pre-existing condition. People are having neurologic effects where they have short-term memory loss, profound fatigue, palpitations, respiratory illnesses. It's just a really odd disease that no one really knows about, and we really don't know the long-term ramifications on how long these people are going to be sick for. But that is going to be a pre-existing condition, and that is going to be a pretty significant piece of the population who survived COVID who are going to have long-term effects, and that will be pre-existing. And so if the ACA goes away, those people won't be able to get treatment. Something actually similar happened after the 1918 pandemic with long-term health consequences for a large bit of the population. And I'm just hoping that we can learn from 1918 and not have to reinvent the past.
The only thing I'd add to that is many people get their insurance through the workplace, and a lot of these workplaces are struggling and laying off folks, and those folks that get laid off don't have access to the exchange if the ACA is thrown out.
It looks like that covers it for our questions today. So I will throw it back to you, Nick.
Fantastic. Thank you everyone for your questions and for joining us. We do appreciate it. If you have any other questions for the speakers or the Protect Our Care team, you are free to reach out to me at protectourcaremt@gmail.com. Again, you can reach out at protectourcaremt@gmail.com, and we'll help you get any other questions you may have needed answered. Thank you again to Senator Tester, Governor Bullock, Representative Stewart Paraguay for your continued advocacy for and leadership in communities in Montana. Thank you to Dr. Giuliano, Amy, Emily, and Elizabeth for sharing with us and your continued advocacy for healthcare in our communities and the services that you all provide. Thank you all for joining us. Have a safe and pleasant weekend. And remember, stay socially distant if you can. And if you can't, please mask up.